One element that we've seen that greatly contributes to a pharmacy's success is your provider buy-in. If your physicians and other clinicians see the pharmacy as an extension of the care team, your patients will as well. One thing that works really well is simply having the members of your care team ask patients if they would like to use your pharmacy today. It's a very simple question, but it creates the messaging and the understanding with the patient that the pharmacy is an extension of the team in the health center. It creates a level of comfort and trust with the pharmacy and also ensures that the patient is going to get their best possible care across the continuum. Health centers are often hesitant to send patients to their own pharmacies because they're concerned it may be perceived as steering patients. What's interesting is that we never think this way when we're referring patients internally to other services. It's important to remember that by offering our patients the opportunity to use our pharmacy, we're in no way requiring them to, and we're not infringing on their patient choice. One benefit of having your in-house pharmacy is that you have certainty that your patients are going to get the medications that they need. By building relationships between your pharmacy staff and your clinical team, you're going to develop trust. And when they send the patient to the pharmacy, that pharmacy team is going to ensure that the patients always walk away with the medications that they need. By working together, the staff within the pharmacy and the staff within the health center will make sure that the patient's needs never go unmet. In the event patients are having difficulty affording their care, the pharmacy staff and the health center team are able to partner together to ensure all of their care needs are met in line with the 340B program intent. Marketing doesn't always have to happen outside of your organization. One of the best places to start is employee orientation. Making sure your health center team is well educated on the services offered by your pharmacy is a great way to get that information to your patients.
When FQHCs think about opening a pharmacy, the first step is getting the pharmacy open, but it doesn't stop there. It's important that you continue to optimize your pharmacy and work with your staff to really increase that engagement so the pharmacy can be successful long-term. In some cases, we assume the patient knows about the pharmacy because they walked in the door and it's right there, but that's not always the case. Sometimes they don't understand that there's a pharmacy there or don't know that they can use it. So it's important that at every encounter inside the patient visit, the patient is talked to about the pharmacy. You can have marketing such as signage in your lobbies and in your exam rooms, but a more important piece is having all of your team talk about the pharmacy. It could be at the front desk, it could be at nursing, but the most important place is the discussion with the medical provider. Our patients trust their medical provider, and they will take their advice on what the best pharmacy is to use. You can highlight the clinical benefits, such as opportunities for compliance packaging and better communication with the medical care team, or those unique services like free home delivery that we have that our competitors may not. One of the most important things that an FQHC pharmacy has to do is know what their capture rate is. If you don't know the capture rate, there's no way to fix it. Simply, your capture rate is a percentage of your prescriptions that are coming to your in-house pharmacy. So it's important to know how effective your pharmacy is. As I've said, it is everyone's responsibility in the FQHC to encourage use of the pharmacy to really increase that capture rate. You can do this in multiple ways, but the biggest way is educating your staff on the importance and what it means to them. Educate them about the services that we provide that wouldn't be possible without the 340B program. That is really the impact that we're trying to fix. If you educate the whole team on capture rate and get them engaged, then you will have your whole team driving success of your pharmacy.
A great metric to use to track your pharmacy operation success is looking at your prescription capture rate. This can be done relatively simply by going into your electronic health record and exporting the prescriptions that are written each month by your prescribers, assessing how many of those scripts are going to your in-house pharmacy as a percentage. The lower the percentage, the greater the opportunity for encouraging your staff to send prescriptions to your pharmacy.
Your pharmacy software may actually have tools that will help you optimize your capture rate as well. There are services such as text messaging that will allow you to increase the number of prescriptions that actually get picked up. There is nothing more frustrating for a pharmacist than to fill a prescription and then it never get picked up, and we get no benefit from that. So look into these services. They may be available at little to no cost for you. There may also be options such as a delivery app or a curbside pickup app that will make doing those processes a whole lot easier, and again, often available at little to no cost. Our team of experts has experience running in-house pharmacies, and we have tools available that will help optimize the success of your pharmacy. Contact us today at FQHC340B.com.